Good afternoon, everyone. I am Montgomery County Council President Gabe Albornoz, and welcome to our afternoon session, which is a continuation of our public hearings regarding the FY23 operating budget. So this is a public hearing on the fiscal year 2023 proposed operating budgets and the FY23 through 28 Public Services Program and fiscal policy for the Montgomery County government, Montgomery College, Maryland National Capital Park and Planning Commission, Washington Suburban Sanitary Commission, and Montgomery County Public Schools. Committee operating budget work sessions have already begun this week and will be followed by full council work sessions, which will begin in May. We thank everybody for signing up to testify. We've already received some very compelling testimony, and we appreciate your civic activism. And I'll just remind everyone that you have 2 minutes to testify, whether you are doing it virtually or in person. And we will begin with our virtual friends who are going to be testifying. And we will start with Carrie Stoltzfus. You may begin.
Good afternoon, Council President Albornoz, council members, and neighbors. I'm Carrie Stoltzfus, the Executive Director of Food and Friends. I'd like to share some of the important work Food and Friends is doing to improve the lives and health of Montgomery County residents, and to thank you for your support through the Senior Nutrition Program. For the past 34 years, Food and Friends has been providing home-delivered, medically tailored meals and groceries to individuals living with serious illnesses such as HIV/AIDS, cancer, diabetes, and heart and kidney failure. Our clients are referred to us from their healthcare providers, and we function as a prescription for nutrition. Last year, we delivered over 1.2 million meals to nearly 4,000 people across the region at no cost to those who receive it, and nearly 150,000 of those meals were delivered to over 450 Montgomery County residents. Our clients are acutely ill and often unable to take advantage of other nutrition programs or shop at a grocery store. Almost 80% report income of less than $1,500 a month. Our services improve health outcomes and lower the cost of medical care, and participation in a medically tailored meal program is associated with improved health, fewer hospital and nursing home admissions, and lower overall medical spending. We're appreciative of our current funding through the Senior Nutrition Program within the Department of Health and Human Services, but it represents only 7% of the almost $1.5 million that Food and Friends will spend taking care of Montgomery County residents this year, and we'd appreciate the opportunity to work with the council to find additional sources of support. We applaud the work of council members to ensure the county is an affordable, safe, and healthy community for all people. We're excited for the strategic focus on food security through the Montgomery County Food Security Plan and the proposed Office of Food System Resilience, and we look forward to additional shared public-private efforts to address this and other social determinants of health. Thank you.
Thank you so much for your testimony. I failed to note at the beginning that two of our colleagues are joining us virtually as well, Council Members Navarro and Reamer. So they are in the audience and listening intently, and of course have staff here among us as well. Next, we will hear from Mr. Will Roberts.
Thank you very much, Council President Albornoz, Vice President Glass, and members of the council. I appreciate being with you. I'm Will Roberts. I'm a Clarksburg resident and also a candidate for County Council up here in District 2 in the Up County. Happy to be with you today to share a couple of words on this really important budget. As we know and is often said, perhaps too often said, but it's true, that a budget is an expression of priorities, and this one is an especially important expression both of the county executive's priorities and your priorities as you guide the funding here. I want to thank everyone for the work that's been done as our communities have been emerging from the pandemic, and this budget, I think, and the work that you're going to do on it will lay, a really critical framework and foundation for the investments in the community services that we need to make sure that our economies are recovering, but also that our communities are recovering. I think that's critical as you are looking at, all of these line items and pots of money, that these services going toward community recovery, investments in our community partners that are working to house, feed, educate, employ our neighbors, is really critical. And so there's lots of important specifics that I could break out, but I just wanted to make a general comment today to say that I appreciate the work that's been done on this council to try to work together to provide those services for our communities, and we really need you all to double down in this effort to do it as we're all recovering from the pandemic. So look forward to and wearing my community partner hat. I look forward to working with you all in that regard, and I want to thank you for all your work. Thanks.
Thank you for your testimony. Next, we will hear from Brian Levine.
Good afternoon, Council President Albornoz, Vice President Glass, and members of the County Council. For the record, I am Brian Levine with the Montgomery County Chamber of Commerce, and we are testifying today to relay some of the Chamber's priorities in the recommended fiscal year 23 operating budget. The Chamber urges Council members to ensure that the budget is, to the best of your ability, prepared to weather any future economic disruptions precipitated by the COVID-19 pandemic. While the Chamber is cautiously optimistic that the county is emerging well from the pandemic, the reality is that the future is difficult to predict, as you know. It is for these reasons that continued investments in areas that improve our economic outlook and make the county a great place to live and work are so important. As with previous testimony, our remarks today are through the lens of attracting and retaining a talented workforce in Montgomery County. Chamber supports strategic investments through the budget because they grow our competitiveness and create a better environment for the attraction and retention of talent. Specifically, the Chamber is strongly supportive of a number of budget items that help advance workforce initiatives in Montgomery County, and I'll talk about a few. These include fully funding Montgomery County Public Schools. Funding for MCPS plays a significant role in creating a talent pipeline in Montgomery County. We also support Montgomery College, which also plays a vital role in meeting all kinds of workforce needs. The Chamber is especially supportive of the $3.3 million request for an East County Education Center to expand access to this underserved region and enhance the county's ability to address workforce needs. The Chamber also supports fully funding the budget request for Montgomery County Economic Development Corporation. MCEDC's mission is so important right now, especially with its efforts to grow and expand our workforce. It is vital that Montgomery County has a robust and aggressive economic development infrastructure to provide a roadmap for increasing economic activity in the county. We ask for your support of these items and others to create a better environment for a talented workforce in Montgomery County. Thank you for allowing us to testify today.
Thank you for your testimony.
Thank
Next,
you.
we will hear from Maria Nacios.
Good afternoon, members of the County Council. My name is Maria Nacios, and I am an MCPS school psychologist serving Whetstone Elementary and Ridgeview Middle School. I am the only school psychologist for 1,530 students. I am a product of the Montgomery County school system myself, and I've been a school psychologist in MCPS for 2 years. I entered the field of school psychology because I have personally witnessed the power that lies in strong collaboration between a family and a school team. I wanted to advocate for students and guide school teams and families as we collaborate to provide mental health and special education supports for students. While my primary role is to conduct thorough and representative evaluations of students, I have also been able to conduct individual counseling sessions, create intervention plans, track student data, and respond to behavioral and mental health needs in my buildings. My ability to continue to provide these supports to students and schools is a risk due to MCPS's inability to recruit and retain school psychologists. As a result of non-competitive salary to neighboring districts and already high ratios, we are unable to attract and retain qualified candidates. I am currently providing services to students at 3 times the nationally recommended ratio of 1 psychologist to every 500 students, and this ratio is unfortunately slated to go up as we face 28 open positions for next year. These open schools will be redistributed onto current caseloads and significantly limit my ability to provide preventative services to students. While I was in high school in MCPS, I had the honor of being selected to participate in the Superintendent's Leadership Program, and I have had the privilege of meeting and chatting with members of the County Council, the Board of Education, and the Superintendent of MCPS at the time. I know and appreciate the County Council's longstanding support of school psychologists and mental health initiatives for students and families. I hope that your ongoing support can help to increase the number of school psychologists that MCPS so desperately needs and can contribute to positive change in future budget proposals. These changes will help to ensure that our students, families, and schools continue to receive the high-quality mental and behavioral health services that they deserve. Thank you so much for your time today.
Thank you, Maria, for your testimony, more importantly, your service. Next, we want to hear from Sora Edwards. You are on mute.
Good afternoon. My name is Sora Edwards. I have had the police called on me and my family several times. I've called myself when I saw no other option. As white folks, our risk of death or violence was much lower, but the police were still completely ineffective, and the trauma of those encounters made it harder to reach out for mental health care later. Budgets are moral documents. How is it that after all the reimagining public safety, our police budget is the highest it's been since Robert White's death in 2018? Our community needs care, not cops. Here's the thing, it's not always going to be someone clearly stating, "Hi, I'm having a mental health crisis." Being sick is criminalized, particularly if you're Black. Ryan Larue was taking a nap in the car he lived in. He was a young Black man grieving several losses in the middle of a pandemic. He was possibly on medication. He had a cognitive disability, but the call that came through wasn't about any of that. It was for trespassing in the McDonald's drive-thru. Response time is a matter of life and death. The police were busy that night and took over an hour to come. Then over the course of another hour and a half, they escalated the situation and eventually decided they needed a negotiator, not a mental health crisis team. The negotiator had to come from across the county. He was 2 minutes away when police shot Ryan for sitting up. We keep talking about how we're going to emulate cahoots. I've been homeless outside Eugene. I know it's tiny compared to here. Our teams are supposed to cover a geographic area that's 10 times larger and search 7 times more people. And yet we've hired about the same number of responders that Cahoots has. So how can we possibly say we're doing anything remotely similar to their model? If we don't get at least 13 teams up and running this year, we won't have enough people power to rapidly respond to the wide range of potential behavioral health situations. That means we'll continue to default to the police, and they'll continue to take Black lives. Thank you.
Thank you. Next, we will hear from Sarah Harris.
Good afternoon, President Albornoz and council members. I am Sarah Harris, representing the Board of Directors of the Montgomery County Retired Employees Association, MCREA, on behalf of Montgomery County government retirees. We are very concerned about the change to the OPEB funding policy in the CE recommended FY23 budget, from contributing to the Health Trust Fund to withdrawing funds from the trust to help pay for the county's portion of retiree group insurance premiums in FY23. This policy change was made with no input from MCREA, the Board of Trustees, or as we understand from any council members. For FY23, the action translates to an OPEB contribution of $0 and a deduction from the trust of $20 million. The long-term implications would be increased premiums or reduced benefits for our 7,000 plus retirees, or the need to replace market gains in the trust with additional taxpayer dollars. County employees now retired provided their best service efforts over many years and rely on their share of health insurance premiums and benefits to be stable and fair. This is very disturbing. Last year, the health trust returns were significantly above average, but so far in FY22, the markets have produced an estimated return near zero. It was our understanding a work group would be formed prior to any change in the funding policy, and that policy would indicate when funds would be withdrawn from the trust to help pay employer premiums. We appreciate your expression of support in our meeting with you on March 29, and we hope that before this policy change is accepted by the council, an updated funding policy is created and the MCREA is invited to provide input. Thank you very much.
Ms. Harris, thank you so much for your testimony and your service. The council did vote unanimously yesterday to reject the recommendation of the county executive. And so we do look forward to working with you on helping to discuss this policy moving forward. We really appreciate you and your members' leadership and service to our county.
Thank you very much. Very good news.
Next, we will hear from Dennis Alexander.
Good afternoon, Council Member Albornoz and Council members. My name is Dennis Alexander, and I want to thank you for the opportunity to present testimony on behalf of Easter Seals in Maryland this afternoon. First, we want to express our appreciation for the very generous 6% increase in the county executive's fiscal 23 operating budget for community grants and contracts. But we're also asking that the council consider this unprecedented environment in which we find ourselves and increase that part of the budget to 10%. As many of you know, Easter Seals provides essential services and on-the-ground supports to people of all ages with disabilities, special needs, veterans, and their families in Montgomery County and throughout Maryland. These programs include adult day services, child development services, respite care, behavioral health care for veterans, and employment services operated from our center in Silver Spring. Nonprofits like ours have been overextended to meet the needs of the community during the pandemic, and we continue to struggle to meet the many needs of the community and sustain the level of service our clients require. The disruption in the labor market caused by the pandemic has forced nonprofits like ours to compete with private and public sector employers who can pay better wages. In our organization alone, we currently have 65 job openings for professionals such as teachers, psychologists, and nurses, right alongside drivers who provide transportation for our clients. These labor shortages and competition for staff have profound consequences for those who depend on our services. A 10% increase applied to all county nonprofit contracts, such as those Easter Seals receives to provide medical adult day services for low-income residents with special needs, and inclusive early childhood education and early detection for children, would be an enormous help in mitigating the challenges our community faces in sustaining critical services in these unprecedented times, and we urge your support of this increase. Thank you.
Thank you for your testimony. Next, we will hear from Matthew Herman.
Thank you, President Albornoz, and to all the council members. Appreciate the opportunity to provide testimony today. My name is Matt Herman. I am chairman of the White Flint Downtown Advisory Committee. We're here today in support of the FY23 budget, but with recommending amendments. Our organization is charged with providing advice to the county executive and to other county leaders about what needs to be done to ensure the White Flint sector plan is implemented as envisioned from 2010. We believe that ultimately a business improvement district is needed for the White Flint area, but the timing is just not right yet. As a result of that, our organization worked with Friends of White Flint, the former and current Bethesda Chevy Chase Regional Service Center directors, to create a new nonprofit, the Pike District Partnership, that would be responsible for placemaking, marketing, and the general upkeep of the North Bethesda area. We were very glad that the county executive had included a new business district development grant program. And we also appreciate that there are continued marketing funds for the Pike District in the budget. However, the demand for that new grant program is significant. And I recognize that the county exec recommended $500,000. I think just yesterday he sent a memo urging an additional $300,000. We appreciate that, but we think that a minimum of $1 million is what's needed given the demand that is out there from organizations like ours and others that are looking to support the different business development districts that are out there. Also, at the council, we are concerned about how quickly these grants can get turned out, how it would be administered. And I think a bigger question being, is this 1 year startup funding or can it be multi-year? We envision the Pike District Partnership is transitional until a bid is ready, so it would be multi-year. So we'd like to work with the council on how this grant program could be stood up. Again, we support it, but think that there needs to be additional resources put into it to make it effective. Thank you.
Thanks for your testimony, Matt. Next, we will hear from Melissa Mckenna.
Good afternoon. My name is Melissa Mckenna. Thank you for offering me live virtual testimony. Speak your truth quietly and clearly, and listen to others, even the dull and the ignorant. They too have their story. Usually I testify for the more than 160,000 plus MCPS students and their families. Today I'm here because of those that have come before me. Ruby Rubens, Odessa Shannon, Steve Goldstein, Pat O'Neill, Harvey Ziegler. They persisted for decades and worked till the end. And because Dr. Seth Morgan showed yesterday that every 2 minutes matter. Ms. Navarro and Mr. Rice, thank you especially for your service and work for our schools, students, and families. Your support has been invaluable, and the loss of your collective experience and institutional knowledge of MCPS will be a huge loss to the council. I'm also here for the kleine Zicken, the small things, people and programs that may be overlooked in the massiveness of the operating budget as a whole. I'm thrilled to see the inclusion of the groundbreaking 6% increase for all nonprofit county contracts. I urge you to fund the full 10% requested by nonprofit Montgomery. Inflation is at 7.9% and annual contract increases have not kept up. These partners have provided essential and irreplaceable services to county residents, most especially during the pandemic. I beg you to also supplement payments for medical adult daycare and developmental disabilities. Direct service providers are essential, indispensable, and often the difference between life or death. Most importantly, I hope you hear the following theme many times today and tomorrow. I am the Black and Brown Coalition. Many faces, one goal. We urge the Council to hold MCPS accountable for assigning resources to students most in need and to hold them harmless should there be any budget cuts. Thank you very much.
Thank you so much, Ms. Mckenna. Just a quick point of privilege here. I and a number of my colleagues had the opportunity to attend a memorial service yesterday for Ms. Pat O'Neill, which was a moving tribute, and I really appreciate you uplifting the work of the members of our Board of Education. Thank you for your testimony.
Thank you.
Next, we will hear from Jennifer Freeman.
Great. Thank you so much for the time here today. Yes, I'm Jennifer Freeman. I serve as Executive Director of Community Farm Share. We're a Montgomery County nonprofit that's focused on local food system resiliency and healthy food access and providing weekly fresh produce bags to families experiencing food insecurity, which we purchase from produce from our local farm partners. This year, we'll provide local farm produce bags to approximately 625 residents each week, meaning about 35,000 pounds of local fresh produce to families in need. From a health perspective, we provide the much needed fresh produce that's in high demand, and the weekly bags mean that people know where their next meal is coming from. This also means that we're investing over $100,000 this year directly into our local small scale produce farms in Montgomery County, building up their capacity to grow more and expand operations, and also bringing new farmers in the program since this model provides a good market opportunity for farmers to sell to. In this way, our work is key to addressing two key issues in the county: nutritious food access and food equity, and building up a resilient local food system that not only benefits families experiencing food insecurity, but to all eaters. Living out in the ag there myself in Poolesville, it's absolutely clear to me that our county has incredible potential to grow more food for human consumption. This year, we're partnering with two school programs, Linkages to Learning and Community Schools, to provide farm produce to families in need, identified MCPS schools that have both have the need, but also have the least current programs serving those communities. Secondly, we're partnering on a pilot program this year with Mercy Health Clinic in Germantown and additional safety net clinics going forward. The partnerships, together with Primary Care Coalition, will establish food as medicine programs at the clinics and will provide fresh weekly produce bags from local farms to people screened for food insecurity and diagnosed with uncontrolled diabetes. This work fits hand in glove with existing county programs and objectives. The program achieves recommendations in the 5-year food security plan and as well as the climate action plan. My hope is that with this testimony today, that budget funds can be allocated to healthy, fresh food access programs associated with Linkages to Learning and community schools, as well as the Primary Care Coalition and community health safety nets, clinics, and starting to expand food as medicine programs. Thank you very much.
Thank you for your testimony. Our next speakers are in the audience, so I'd like to welcome to the dais Ms. Judy Clark. There's a button with, looks like a little person speaking. There you go.
Greetings, President Albornoz and Vice President Glass and council members. I'm Judy Clark, CEO and founder of Women Who Care Ministries. Very dear to my heart is ending child hunger. For 21 years, we provided critical services, especially through our Helping Kids Eat Weekend Meal program. And during the height of the pandemic, we provided 7,000 weekend meals for kids each Friday via the curbside grab-and-go model. And when schools reopened in September, we pivoted to our original model of direct service to the schools. For fiscal year 23, the amount we were awarded for this program only allows us to provide weekend meals to 123 students per week for the 42-week school year, although we already have 2,500 students on our roster. Matter of fact, just one of our schools has 220 students currently receiving the weekend meals. Clearly, our budget is not sufficient. The specifics of this gap are outlined in our written testimony. Although emergency funding has ceased, child hunger continues to skyrocket. The government waivers for MCPS meals are ending June 17, and schools are reaching out to us daily, seeking for ways that we can help them provide not just meals in September, but summer meals as well. As always, we want to stick and stay and remain in the fight to end child hunger, but we need the additional funds in order to be able to do so. Otherwise, we can't even offer the weekend meal program this coming school year. Please provide the additional funds to allow us to feed the 2,500 students weekly next school year through this irreplaceable program. Child hunger, so serious yet so solvable. We've definitely got what it takes, not just to provide weekend meals, but to begin incorporating the many strategies we have developed to strategically address the root and underlying dynamics of hunger. With your increased funding, matched with our tenacity and gift of ingenuity, we will continue to play a significant part in ending child hunger, one day, one precious kid at a time. Thank you.
Thank you so much, Ms. Clark. Next, we will hear from Ericbrenner.
Hi, Mr. President and other council members. Okay, my name's Ericbrenner. I'm a retired state employee. I've been a Silver Spring resident for the past 27 years. My wife and I are two of the lead volunteers with the Montgomery Explorers Program. It's a walking program for people over the age of 50 years old run by the Parks Department. They have one paid staffer. She handles all the logistics, weekly communications, and online registration responsibilities. We've had between 30 and 50 people walking outdoors each week all over the county and all of your districts in all 4 seasons. We started in early April 2021, right in the midst of COVID. We've been leading these outdoor walks, mostly on county parks property and on trails. At first, some of the walkers really struggled to go for even 30 minutes. Now they seem to have no trouble covering the 4 miles that we do on most of our walks, and many friendships have been formed there. This being a budget hearing, my plea is to give the Parks Department whatever they asked for in their initial budget request. As a career state employee in multiple states, I've worked with and managed a lot of volunteers, and I've never seen anything like what these folks have been able to do during a very trying COVID time. Just one quick example, this past Monday, a miserable day by any measure, about 35 degrees, sleet and rain. We had 3 new first-time walkers joining 22 of our hardy regulars. One of the new walkers was an Army veteran. She had recently, she'd been wounded in Afghanistan, recently rehabbed at Walter Reed. Another new resident just moved in from Michigan to be closer to 2 of her sons, one of whom insisted she get out and meet some people. He drove her to this meeting. By the end of the day, they realized that they'd both been stationed in Germany at the same time. Cold and wet, these 2 women, one black, one white, got in the car and drove off to the library together, pretty pleased with the programs and amenities that you all fund in Montgomery County. So that's just from this week. I have stories like that from throughout the year. I'm not sure how you quantify or monetize a day like that, but without the budget for the staff at parks and the quality of the county parks and trails, it wouldn't have happened. So just remember that as you're contemplating any changes to the Parks Department budget. Thank you.
Thank you so much, Eric. Next, we will hear from Kathy Hedge.
Good afternoon, Council President Albornoz, members of the Council. Thanks so much for the opportunity to speak with you this afternoon. I'm Kathy Hedge. I'm the Executive Director of the nonprofit organization Parent Encouragement Program, also known as PEP here in Montgomery County. I know you are well aware of the mental health crisis that is facing children and families. What I'm here to tell you is that PEP, our organization, has the capacity and the experience to do more to help. We know, and research shows, that a close connection between a parent and a child is one of the best ways to help that child cope with stress and anxiety. And that's what we do at PEP. We help parents develop a strong relationship with their children so that their children feel safe, seen, and soothed, and so that they grow up to be resilient, capable, and confident adults. PEP has been around for 40 years. We've delivered programs with the Linkages to Learning program for the past 6 years, mostly in Spanish for new immigrant Latino parents. Our programs are culturally competent and they are responsive to parents of different backgrounds and contexts. I myself am a parent who came to PEP 10 years ago. I have 2 children, and I will tell you, PEP saved my relationship with my younger son, who is now 21 years old. We appreciate that PEP is in the budget, the FY23 base budget right now for $21,000 to serve 80 parents in 4 schools next year. But I can tell you that is a drop in the bucket compared to the need right now. And we get many more requests each year from schools that ask us for much more than that budget can support. And the thing is, we have the capacity to do more. So we are requesting that the PEP program be increased from $21,000 to $300,000 next year, which will allow us to expand our program and serve 1,200 families in 30 schools next year. We are in discussions with the Department of Health and Human Services, and they are supportive of this expansion. We ask that the final budget contain funding for this expanded program so that we can help more children now and for the years to come. And finally, I'd add that we are members of Nonprofit Montgomery, and we do support their request for the full 10% increase for nonprofit grants and contracts. Thank you.
Thank you so much, Kathy. You teed that up nicely. Next is Franca Brilliant from Nonprofit Montgomery.
Good afternoon, Council President Albornoz, Vice President Glass, and Council members. I'm Franca Brilliant from Nonprofit Montgomery, and I'm really grateful for the opportunity to testify on behalf of Nonprofit Montgomery's 200 members and also our collective impact initiative, Montgomery Moving Forward. We are very proud of the partnership that we have built with the county government and the work we are doing with your help to strengthen nonprofits through technical assistance, convening, information sharing, and training. We look forward to working especially with the new grants office to increase the resources going to nonprofits, especially to those community-based nonprofits with limited or no staff, who are often found in communities with the greatest needs and the least money. We really appreciate also the county executive's decision to incorporate a 6% across the board increase on all nonprofit grants and contracts. That is very important to all of us. But we persist in our request to the council to include that 10% increase that we made, the 10% increase that we asked for. It's not an inflationary increase. Our costs for health insurance, tech, labor, food, and a number of other things have gone up significantly more than the actual 8.5% inflation that we are seeing nationally. This increase will allow us to build the back-end support for the effort that we have put in over the past 2 years, which you have heard about repeatedly, and that we must maintain to meet the continued high level of demand from community members. It will allow us to pay more competitive salaries, which is essential in this labor market. And it is an important equity measure, as starvation budgets of many of our nonprofits means they can't pay health insurance and other benefits. During this budget process, you will hear, as you have from many organizations, about the specific needs that they see. Nonprofits, these among them, are innovative, resourceful, and committed to the residents of Montgomery County, but they can't run on fumes. We ask that you add an additional 4% to the budget for a one-time 10% increase so that we can do the work that Montgomery County residents rely on. Thank you very much.
Thank you very much. Next, we will hear from Larry Bram.
I'm Larry Bram. I wear a number of hats, including as an SVP at Easter Seals and a member of the Commission on People with Disabilities, but I'm here today to speak in my most important role as a parent of a daughter with developmental disabilities. I'm here to urge you to add funding in the budget for the MoCo Better Beginnings initiative to reach the audacious goal of Montgomery County becoming the first county in America to screen 100% of their children for developmental disabilities. The moment my daughter was born, we knew something was wrong. She had her first MRI when she was 5 days old, and we were told she was missing part of her brain and would probably never develop language. As you can imagine, we were devastated. However, the next thing the doctor told us changed everything. He put us in touch with the Montgomery County Infants and Toddlers program. Sarah began services when she was only 3 months old. Fast forward 28 years to today, Sarah has a BS degree in speech and hearing services, talks a lot, and lives independently. Her journey highlights the plasticity of the brain. Clearly, Sarah had the privilege of the parents that she had. The system is too hard for many people to navigate, and this initiative is designed to increase equitable access for underserved communities. We've been working, a broad coalition has been working since 2018 on this, to really solve the problem that so many children enter kindergarten with undiagnosed disabilities. When we began, the CDC said the autism rate was 1 in 60. 4 years later, it's now 1 in 44. Autism can be diagnosed at 18 months, yet most diagnoses come after 4 years of age. We're missing time that we can never get back. Earlier is better. MoCo Better Beginnings is a modest investment with the potential for massive impact in transforming the lives of our young children, particularly children from underserved communities. I know this through hard-won experience. This is the best investment you can make. Thank you.
Thank you so much, Mr. Graham. Next, we will hear from Susan Greif.
Oh, you pronounced it correctly. Mr. President, Vice President, and Council, my name is Susan Greif from Imagination Library of Montgomery County. For me, it would be Blueberries for Sal or The Little Engine That Could. And I'm sure you can vividly remember a children's book that you read with your family. This is the power of reading. As a reminder, we are an affiliate of Dolly Parton's Imagination Library. We mail free, brand new, age-appropriate books, one every month, to children from birth to age 5 in 7 area zip codes: 20850, 51, 20877, 20895, 20903, and most recently 20906 and 20912. Throughout the pandemic, our program has actually thrived. We've moved to all online registration, added 2 new zip codes to our coverage areas, and doubled the number of children enrolled. Our books have arrived without any interruption. 10,000 books since March of 2021, 4,400 books in 2022 alone, and 42,000 books since we began 7 years ago. And we are on the cusp of some very exciting changes. The Young Readers Program Expansion Act was introduced by Delegate Mark Corman and now awaits Governor Hogan's signature. It will provide some matching funds for local affiliates like ours, and we hope that this is just the beginning of more robust state support. We certainly appreciate your ongoing support for our organization and early literacy. Thank you.
Thank you so much. Next, we will hear from Dianeeisenstadt.
Good afternoon, President Albornoz, Vice President Glass, members of the Council. I'm Dianeeisenstadt, the Executive Director of the Affordable Housing Conference of Montgomery County, on whose behalf I testify today. HCMC has advocated for safe, decent, and affordable housing as a right, not a privilege, for 31 years. We continue to convene legislators, developers, housing officials, and a myriad of cross-sector partners and experts. The economic, health, and housing challenges of this COVID era serve as a clarion call to action and a testament to just how critical the lack of available and affordable housing is for too many Montgomery County residents. Greater than half of our residents remain cost-burdened. Though the Congress passed the Fair Housing Act over 5 decades ago, the home ownership inequity between white and African American families is 32%, and racial inequities persist in meeting virtually every desired public sector metric. We still have a long way to go. With that journey in mind, we are ecstatic about the nearly $100 million allocation in the FY23 budget for the preservation and development of affordable housing. Still, we need to invest more than $120 million a year to meet the Council of Governments' 2030 housing target, which we have embraced. We know that living safely and affordably housed is essential to our health and well-being and our ability to succeed and be productive at work and in school. It's the foundation we aspire to provide all of our residents and especially our children. In this era of unexpected revenue and state surplus funds, AHCMC encourages the County Council to consider an even greater investment in affordable housing in 2023. Affordable housing is always a good investment. Now more than ever, in conjunction with effective land use policy and legislation, we need to accelerate this investment to meet the need and level the playing field for all. We know it'll pay great dividends for our community. Thank you for your stewardship and the opportunity to speak with you today.
Thank you so much for your testimony. Next, we will hear from Shannon B Thomas.
Good afternoon. On behalf of Community Bridges, I want to thank the county for the continued support of our organization. For 25 years, Community Bridges has been empowering girls from diverse backgrounds to become exceptional students, positive leaders, and healthy young women. CB supports girls here in Montgomery County that are currently living in poverty. In fact, 92% of our families have an annual income of $45,000 or less. Our unique approach centers around a holistic strategy empowering young girls to excel academically, gain leadership skills, and have healthy minds and bodies on a 10-year continuum from 3rd through 12th grade through our after-school, mentoring, college access and success, equity inclusion, and our family support programs. During COVID-19, we provided support to over 400 girls and their families. We provided a safe space where girls could share what they were dealing with. We provided academic support and assistance, and we've continued to ensure that academic success. And we've been a connector to our families with access to food. In fact, over 500,000 pounds of food, thanks to over 100 volunteers. Our college access and success program has continued to grow. All of our girls know that college is a real option for them. Through our mentorship and programmatic support, girls will break the cycle of poverty for themselves and their families using education as a vehicle. I want to share just one story with you that exemplifies what CB does. In May of 2020, we met with 2 girls in our program that were struggling with the pandemic. They were worried about what their future would look like, and they were thinking about dropping out of school. Well, let's flash forward 2 years. Both girls are getting ready to graduate from high school this year, and both girls will be going to a 4-year college on a scholarship. Amazing. It goes to show you that when an organization is able to provide holistic support and wraparound services, lives are changed for the better. I urge the council to look at the 2023 operating budget and ensure that nonprofits have the support to continue the critical work of supporting our most vulnerable here in the county. I'm requesting that the county council maintain the recommended 6% increase for nonprofit contracts and add a 4% increase for a total of 10%. This will ensure that we're able to continue offering the services and support that is needed to serve our most vulnerable residents and will allow Community Bridges to help our girls become exceptional students, positive leaders, and healthy young women here in Montgomery County. Thank you.
Thank you so much. Next, we will hear from Dr. Michelle Larue.
Good afternoon, Council President, Council members. My name is Michelle Larue. I am the co-chair of the Latino Health Steering Committee. We are an independent group of volunteers, professionals, and community leaders that act as the planning body for the Latino Health Initiative, provide expert guidance and technical assistance, and advocate for practices and policies to improve the Latino health, the health status of the Latinos in Montgomery County. We support the county executive's proposed increase of $2.2 million to the LHI's current base budget. In addition, we are requesting $950,000 in supplemental funds. With your support, a private-public partnership for Nuestra Salud y Bienestar program was launched in July of 2020 to enhance the county's efforts to reduce disproportionate rate of the COVID-19 cases among Latino community. This innovative one-stop wraparound service delivery model has provided testing and vaccination, case management, including utility and rental assistance, community health, mental health, food and essential goods distribution, a Spanish information line, hospital at home, education through community health workers, and a robust media outreach approach. FY23 is projected to be a transition year for the pandemic, and LHI and Por Nuestra Salud are well suited to respond to the ever shifts within the pandemic. We know that this would likely entail a potential new variants addressing the long COVID challenges that our community is facing, as well as implementing post-COVID recovery efforts to fill the needs as well as those that have been exacerbated by the community. In addition to the funds that we are requesting, it would allow LHI to adopt or expand program areas that have been shown effective through the Por Nuestra Salud program, including tailored case management, community mental health, and a comprehensive communications and outreach campaign. Thank you.
Thank you so much, Dr. Larue. Next, we will hear from Reverend Catherine Pogaleko.
Good afternoon, council members. My name is Katie Pocalico, and I am the pastor serving Living Faith Lutheran Church in Rockville. Our congregation operates a feeding program that weekly provides 120 families with 3 bags of grocery each, serving nearly 625 individuals weekly. About 1/3 of the food that we give out comes from the county through a wholesale purchase program with the Food Security Task Force. From this, we're able to distribute beans, rice, eggs, and most importantly, fresh produce to our pantry guests, the vast majority of whom are new immigrants living in multifamily, multi-generational households within 2 miles of our church. In January of this year, our funding was cut 25% in order to prepare us for the funding to cease entirely on June 30th. This funding and access to the wholesale price food will end on June 30th, not only for us, but for around 30 other organizations, churches, synagogues, and mosques who operate similar programs. Funding for this critical, hyper-local food security work has not been written into the 2023 budget. And so I ask you to consider adding $1.6 million, or 0.025% of the budget for these programs. I know the budget contains $4 million to support feeding hubs that have sprouted up during the past 2 years. I commend this initiative. However, we work closely with our local feeding hub in Twinbrook, and their leader and I agree that the hub's work cannot go as far or as deeply into the neighborhood as a program like our churches. We are better able to serve our neighbors who remain outside the hub's reach at no other cost than a small supplement for food purchasing. I'm not convinced that the pandemic so much created for food insecurity as much as it did uncover the need that was already there. So I speak in favor of creating a budget line within the Health and Human Services for food security initiatives outside of the hubs. Thank you very much.
Thank you for your testimony, Reverend. Next, we will hear from Manny Iralgo.
Do you have to press something? No. All right, thanks. Good afternoon. My name is Manny Iralgo, and I serve as Executive Director of Shepherd's Table. Headquartered in the county's Progress Place building in downtown Silver Spring, our nonprofit's mission is to improve the quality of life, create a pathway towards self-sufficiency, and inspire hope for the most vulnerable experiencing food insecurity, homelessness, and poverty. Since 1983, we've been preparing hot, nutritious meals coupled with comprehensive social services to thousands of the most vulnerable residents of our county, always in partnership with Montgomery County government, for which we are very grateful. Since the start of the pandemic in early 2020, we've experienced a 59% increase in the demand for our meals and social services, and yet funding from Montgomery County has only risen 6%. Fortunately, individual donors have stepped up, and we've experienced a remarkable 76% increase in giving from them over the last 2 years. Foundations also stepped up their giving to Shepherd's Table during the pandemic by 60%. Places of worship significantly increased their giving by 41%. Now, with inflation rising and donor fatigue setting in, we've started to see a 43% decline in individual donations as of February of this year. Therefore, we request that the County Council step up its commitment to serving the most vulnerable members of our community and raise its funding for Shepherd's Table for FY23 from the County Executive's proposed 6% increase to $463,568, a 59% increase in funding to match the 59% increase in demand, which basically amounts to $172,000. It's important to note that our total funding for 2022 is projected to be over $2 million, and therefore such an increase in Montgomery County funding would still only represent 22% of all our funding for the year. Shepherd's Table will continue to be an exemplary nonprofit organization that leverages county resources on a nearly 5-to-1 basis and attracts 2,000 volunteers and $1.5 million worth of in-kind donations. We're not requesting that the county supplant the private sector's commitment, just rise to the bar that the private sector set during the pandemic so that we can continue helping thousands of our most vulnerable county residents create a pathway towards self-sufficiency. Thank you.
Thank you for your testimony, Mr. Hidalgo. Next, we will hear from Ana Martinez.
to turn it on. Okay. Yes, I apologize. Good afternoon, members of the council. My name is Ana Martinez. I'm here on behalf of the Montgomery County Racial Equity Network, a coalition of various organizations and activists fighting for social justice. We're thankful the council passed the Racial Equity and Social Justice Act a few years ago, and we would like to ask the council to increase funding for the Office of Racial Equity and Social Justice and the Office of Legislative Oversight. We are fortunate to have this leadership of Dr. Bonner Thompson and the Chief Equity Officer, Tiffany Ward, who have been leading this work within our county. This includes providing racial equity analyses for all county bill, racial equity discussions among county departments, and leading a community advisory board. We should provide the resources and staff these two directors need and ensure that their teams do not burn out and are able to handle all the various requests as their workload continues to increase. We ask the council to support departments fighting for racial equity that are providing services and opportunities for our community and decrease funding from departments that are creating more harm within the BARC community. By this, I mean we should not be supporting the funding for the MPCP Community Resource Bureau, which would increase police presence within our community and all schools. Instead, we should move fundings towards housing, food security, mental health, social services, and advancing equity. Let's make sure that our budget reflects our values as we continue to provide resources to our communities. Thank you.
Thank you so much, Ms. Martinez. So that concludes our speakers for this public hearing. And so this public hearing is now closed. We will continue our public hearings later this evening, which will be done virtually. But let me just thank everybody for your passionate testimony this afternoon. It was incredibly effective. You did your organizations and communities and families very proud and gave us a lot to think about today. So thank you all so much for your commitment and dedication. And with that, we are adjourned.